Hello, my name is David Bowers. I'm a plastic surgeon at North Carolina Plastic Surgery Center, where we do a full wide range of cosmetic surgery procedures. Today I'd like to talk to you about breast augmentation. Breast augmentation is a very popular procedure. It is performed throughout the country by a wide variety of surgeons, most of whom are plastic surgeons. The people who are seeking breast augmentation are generally young women who have a feeling that they would like to improve their self-image. The good candidates are women who are interested in doing this for themselves and are confident that their primary motivation is to just improve their self-image. Patients who are not good candidates for this procedure would be someone who has possibly considered that it might improve their self-image to a degree that's just simply not possible. It might improve their lifestyle, it might improve their career opportunities, but in the final analysis, a breast augmentation really is intended to give a woman larger breasts and improve her self-image, and it's really not intended to do anything more than that. The procedure is performed under a general anesthesia usually. It is performed at an outpatient surgical center, and it requires about 1 hour of surgical time. The options in terms of the placement of implants would be either to place the implant behind the muscle or on top of the muscle. And this can be done through a variety of approaches. These include a small incision in the crease underneath the breast, around the nipple-areolar complex, or in the axilla. It's important to talk to your surgeon about preferences for that and for positioning and for the approach and the reasons why. There's also a choice in implant type. There is a saline implant, which has a silicone shell that's filled with sterile saline or sterile salt water, and a silicone gel implant that again has the same silicone shell but is filled with a silicone gel material. And again, that's a choice that a woman can make at the time of her consultation with her physician. When selecting a surgeon for this procedure, it's important to find someone who is willing to take the time to do a thorough breast examination, which would include an examination for breast masses or lumps, as well as the lymph node areas, and to take careful measurements in order to size the patient for the implant. In addition, it's important to find a surgeon who you make a connection with. It happens at this initial consultation and in subsequent consultations, and I think both the surgeon and the patient know when that has happened. It's something that can't be explained completely, but it definitely is a very real relationship that forms, and it's obvious to both patient and surgeon when that is happening. When after the surgery, the recovery time begins with a few days of postoperative pain. This could vary from one patient to another, but it generally lasts for a few days, and it should become better with each passing day. The postoperative pain is managed with usually with a combination of pain medication and a muscle relaxant. And then after that, the recovery process really amounts to allowing appropriate healing time in order to avoid postoperative complications. During the early postoperative phase, there will be visits with the surgeon who will advise the patient in terms of massage of implants in order to maintain softness and allow these implants to drop into position, because oftentimes after placement of the implant, especially when they're placed below the muscle, they tend to ride a little bit high in a higher position than what would be desired, and that's a natural process, allowing these implants to drop in position. And it's important that the surgeon spend time with the patient with some visits and during that first week after the surgery in order to carefully instruct her on how to do those exercises properly and appropriately. Generally, the recovery time is complete at around 4 weeks if the implant has been placed on top of the muscle, or around 6 weeks if it's placed underneath the muscle. Placing an implant underneath the muscle requires a little more healing time for the muscle. At that point, if patients have healed well, then they may gradually resume normal activities. Likewise, the implants should, during that period of time, assume the position that is desired by both the patient and the surgeon. I hope this discussion has been of benefit, and if you're interested in contacting us, or if we may be of any further assistance, you may contact us at North Carolina Plastic Surgery Center. Our phone number is 336-275-0919, or contact us on our website, yourplasticsurgeryinfo.com, and just click on Contact Us.